If we are the first that you see, your chance of needing surgery drastically reduces. Your chance of being prescribed an opioid drastically reduces when you see a chiropractic first. We have studies on us improving headaches, neck pain, back pain. There's even studies showing certain extremities that we can improve on.
You only have one body throughout your entire life.
Yep.
You have to maintain that or know how to maintain that so it doesn't affect your mental mindset. We're increasing that communication between brain, spine, out, and then back and forth, which the better communication you have, less pain, less limitations, better biomechanical efficiency.
100%.
It's just a whole cascade of events, which is one of the reasons why I personally became a chiropractor, because you can see that when you only have one body your entire life, and the main thing controlling everything is your spine, and if there's any problem with that, then it can lead to a whole bunch of issues. So if you're able to correct just that itself, that communication, it opens up everything from there.
Welcome back, everyone, to the Functional Code. We are excited to bring you guys today another core episode. This is where we take a recent podcast and we dive into the gems, the nuts, the bolts only. So we are excited to talk today, especially about this one. This is near and dear to our hearts, obviously. We're going to be talking about chiropractic itself. So not only what is chiropractic and some of the other conceptions around it, but how it can help you, some of the benefits, and all the crazy stories that we have seen in our 5+ years of practices. As always, I am Dr. Addy.
And I am Dr. Jace. Yeah, both chiropractors, looking at it from the perspective of if people have questions of, is chiropractic worth it, or is it beneficial, or they've heard that you have to keep going for your entire life.
Yeah.
There's certain specifics. We'll answer all those fun questions as we go through. But Doc, what are certain fun statistics that people may not realize?
Man, I got thousands.
So much.
I have thousands of them. From all of the research that I've gathered over the years, there's been more as of late. Chiropractic's done a really good job of creating more research probably within the last 10 years, more so in the last 5 years. Some of the big studies that have came out were the Lancet series on low back pain, basically explaining that within the last decade, how we managed low back pain was an atrocity. Medication, opioids were not the direction that they should have gone. It actually caused more issues. It was harmful, and unfortunately, we ended up really screwing the pooch on how we should have been helping patients with low back pain. However, they did come out and said, now we should be doing chiropractic first, acupuncture, physical therapy. These are the things that you should try first for low back pain. And we had that in the Lancet, which is a very large, high quality journal. And to have that really solidified us as the primary musculoskeletal experts that you should be seeing first line when you have muscle pain, back pain, joint pain, neck pain, even really any musculoskeletal pain. We really do a great job of managing that first before you should be either seeing someone for medication, rarely, or surgery, or even pain management.
Yeah.
That was a good one. Another one we've seen shows chiropractic use can decrease your chance of surgery before starting with any provider. If we are the first that you see, your chance of needing surgery drastically reduces. Your chance of being prescribed an opioid drastically reduces when you see a chiropractic first. We have studies on us improving headaches, neck pain, back pain. There's even studies showing certain extremities that we can improve on. Really, we should now be, hopefully within the next 5 to 10 years, starting to be almost a primary pain physician in a way, where we are one of the first to come to manage pain, especially musculoskeletal, and hopefully take some of the burden off of medical doctors.
Yes.
Rerouting those pain patients to other providers, take that step away, because first and foremost, what happens, they go to the ER, they go to urgent care for pain. You know that their doctors are just trying to help. They're going to more than likely prescribe a medication. They might prescribe PT. Hopefully they prescribe PT. But that window of time before they see a provider can be long. In the VA, 6 months wait list for some VA hospitals to see a chiropractor. Too much time, too much can happen in that window. And this is why chiropractors need to hopefully be put in hospitals, which we're getting there. There's some are definitely being put in hospitals, but we just need to be closer to these patients so that we can help them avoid surgery and avoid medication.
Absolutely. Everything you said, I fully 100% agree with. And also with certain chiropractors, I also think that we have to move into the space of addressing some of the tissues and muscles and looking at it from that perspective just as much as just the bones itself.
Exactly. Expand on what we learned from school.
Exactly.
100%.
It's a little bit of an uphill battle for some of those individuals, docs that have been in practice for years on end. Not all, but a few, and I get it with life and learning new things. It's challenging, it's mental effort. We understand it from that perspective, but if you're trying to search for a chiropractor, you want to look at someone that not only just addresses the spine, but also addresses the tissues around it. So whether they have like physical exercise, certain stretches, rehab, any type of structure on that front with chiropractic is a step in the right direction.
100%. 100%. And there are times where we see such better outcomes when patients get this multimodal approach to care.
So much.
And there's research already being shown that multimodal approach to care gives such better outcomes than usually just linear treatment. We love physical therapy. We are friends with a lot of physical therapists. Sometimes we differ in our approaches, but even just being able to get to a PT as soon as possible, we still recommend.
100%.
And it's only going to boost your outcomes when you start taking this approach to bettering yourself, but also doing it yourself and getting the knowledge to learn this, to do at home, consistently practice these exercises. Right away, we definitely want you to come and ask for help. A good provider, in my opinion, is one that teaches you the tools, teaches you how to do these things by yourself, and pushes you to get out of your comfort zone, start to train even, work on your other parts of your body too. Obviously, if you've listened to Doc and I, we don't just talk about pain. We're talking many different things: breath work, longevity, supplements. All of these things are only going to benefit you if you have that knowledge.
When we're looking moving forward as well, like why, like going back to some of the statistics that you said, why are we having all this pain? And having the general understanding to maintain this structure of yours, and how different that is from like your soul, your nervous system, your mental mind. It all works together as one, but you only have one body throughout your entire life. You have to maintain that, or know how to maintain that, so it doesn't affect your mental mindset, soul, if we will. So when we look at the statistics in pain and why some of this comes about and why we're some of the first providers that people should see is when you look at the spine and when you look at the small muscles and tissues surrounding there, those have a lot of the pain receptors, they have a lot of the pressure receptors. So if there is interference of that, either communication from brain to tissues, brain to body, brain to organs, it's going to start to affect how the body works, and it's going to affect different pain cycles. If you're having pain, there's something going on. There's a problem, whether it's psychosomatic, whether it's actually physical. Then it goes back to knowing what provider to go to, and that's what Doc was saying. Like, you gotta see someone that can look at your structure from multiple points of view. You have a better provider that can understand the root cause of the problem, and either what direction you need to go, whether it's referral out to see this person in conjunction with this. But I guess, Doc, what is your perspective of, one, how the nervous system is regulated through the body, and then body back to the brain?
I would say another maybe way to think of a chiropractor is a biomechanical expert.
Ooh, love that.
We truly understand the forces put on the body. We also understand how the body responds to said forces. And we also understand the progression or regression of tissues and joints and all of it. All of that is included in the body, nerve especially. And in order for us to get you from where you are to where we think you can get to, we have to almost predict what that pattern should look like. And almost always, it starts at the joint. Would you agree, Doc?
100%.
Okay.
First signaler.
Perfect. So for us, we are always going to be making sure that your joints are moving appropriately. Doc does always a great job of explaining that the joint is usually the first line of communication to the brain, so that's why we are specific on starting with joints. But we look at other things than just the spinal joints. We can look at your shoulder joints, hips, knees, ankles, all these joints. still have the same usual makeup, and that includes, like Doc said, receptors, proprioceptors, all these things that helps us feel in space, pain receptors, these things. And so the joint is, in our opinion, the first place we look at. We want to make sure it's moving appropriately, and if it's not, that is what the adjustment is for these joints, and that is done as known as a spinal manipulation or extremity manipulation or an adjustment. And these are ways that we can allow the joint to move better. There's usually less pain, there's more function, and we'll see a lot more improvement when we can free up the joints that aren't working appropriately.
Yes, it's a lot of times people can think of it as getting popped, getting cracked.
Yeah.
It feels good anytime you release cavitation or a pop in the joint. It also releases endorphins or these happy hormones as well, which is why it feels good and why some people self-adjust to relieve the tension. But usually when they do that, more times than not, they're moving the area or joints that are maybe too hypermobile versus the ones that have been stuck for long periods of time. And those are the ones we're looking to target. Those are also the ones that can have more pressure on the nerves as they come out of the spine into whether it's an organ, gland, tissue, any part of the body. And we're increasing that communication between brain, spine, out, and then back and forth, which the better communication you have, less pain, less limitations, better biomechanical efficiency.
100%.
It's just a whole cascade of events, which is one of the reasons why I personally became a chiropractor, because you can see that when you only have one body your entire life, and the main thing controlling everything is your spine, and if there's any problem with that, then it can lead to a whole bunch of issues. So if you're able to correct just that itself, that communication, it opens up everything from there.
And some of the greatest performers on this earth love their chiropractors. I think every major sports team now has one, whether it's MLB, NFL, NBA. We're on every team. Now hospitals are starting to add us. This has been starting now for the last 5 years. We are a core part of, I would say, not only improving pain in a lot of these teams, but improving performance, function, optimizing outcomes.
I think a huge key takeaway to this whole thing that can take you a step further would be looking at some of the small muscles that attach around the spine. And the reason I say that is if you're consistently getting adjusted and it may help for a period of time and then it comes back, if you don't build this, like the muscle structure, the tissue structure around the spine, that's probably obviously a reason, a huge contributing reason why. There's other aspects, whether it's hormones, glands, a bunch of other different things with that. But when you look at building up those tissues, you have to do that in a very specific way. And if you've heard some of the podcasts before, isometric contractions, just squeezing the muscles works incredibly well. And there has to be progression, obviously. But let's say you have a lot of tightness in your lower back or upper back or shoulders, quite frankly. A perfect tool that you can use would just be touch the tight muscle and squeeze it. You don't have to stretch it. You don't have to put heat, ice on it. Yeah, those things may help, but if you're able to increase that communication via contraction, which is one of the only ways that you can go about it other than a passive route, you want an active route to where you're actually controlling it. That is a tenfold route to where you can accelerate the stabilization, you can accelerate the communication, thus less pain around the area, and increase mobility and everything from there.
And I would say one of the more common issues with the joint is instability that we find. And it's from a deconditioned spine. They sit more frequently, they don't work out a lot, the tissues have been breaking down over time, and the joint is now either locked up or the tissues around it has become rigid because the joint's job was to be stiff and stable, but if that's become unstable, now the muscles have to be stiff and rigid to protect the spine. But what is happening when that happens? Stiffness, pain, all these other outcomes.
Gravity.
Yep.
Arthritis is the answer. Degeneration, it breaks down. It's it's inevitable until you create that pumping action, getting blood in, getting lymphatic drainage out.
100%.
It's all within that.
So when we assess the spine, we are feeling around for these restrictions, and we want to make sure that they're working all the joints are working appropriately, but not only that, if there is a breakdown in the spine or in the joints, this could also affect what it's protecting, which is the spinal cord and nerves,
Yes.
the nervous system. So we can break it down into two ways. We can have central nervous system, or peripheral nervous system. So the central nervous system involves the brain and the spinal cord. The peripheral nervous system is the nerves that we have. Now, whether we have disruption outside of the spinal cord and brain in the nervous system out here, or we can have it internally where it's right onto the spinal cord and the brain. This is done whether there's an injury right to the cord, brain injury, TBI, those kinds of things.
Yep.
Out here would be as if we damaged a nerve via impact. Maybe there's compression from a muscle or a disc or something like that. And these are all the ways that it can be affected. So why we need to understand this is because it can present in different ways. A central nervous system issue can present a lot differently than a peripheral nervous system issue. And these are all things that we look at as chiropractors. But one of the big ways that we talk about improving the nervous system is done via sympathetic and parasympathetic application. So our sympathetic system is what drives our fight or flight response, okay? It allows us to basically increase the drive, I guess you'd call it, in a lot of our more upregulating systems that would help us in a fight or flight situation. Sweating, pupil dilation, it slows down digestion, it increases our heart rate, it does all these things that ramps up our body, our blood flow, so that we can fight or flee. The parasympathetic system is our rest and digest system. It allows us to lower heart rate, it allows us to recover, it improves cellular turnover, rehabilitation, recovery, those kinds of things. And one big way that we can improve the parasympathetic system is by breathing.
Yes.
And we tie a lot of breath work into chiropractic. We do a lot of breath work as providers and even for ourselves. And I would say that not only does it improve the nervous system, but breath itself can improve our physical structure. And we've seen this so many times in patients, whether it's rib cage issues, thoracic spine issues, and even just jaw pain, all these other things that we tied breath into. Doc, do you want to just talk a little bit about some of the other ways that we can improve patients, whether that's joint work, breath work, and just other, we'll call it tools that they can take and use for day to day?
Love that. So when you look at each joint and the small tissues around there, you want to build up the structure, not only the spine, but like you said, the rib cage, and that can come whether it's taking a breath in, holding that breath in as big as you can, and then going through functional movements, whether it's holding the breath in and going through what's known as thoracic workspace or thoracic cars, spine cars, to where you go into rotational movement, make the biggest circle you possibly can as you're breathing in, especially if you have pain like on your backside with breathing. Usually there's compression between certain bones which can affect the tissues between each rib, thus causing the pain itself. So you breathe in, opens up that passage a little bit more. So that'd be one. Another way you can go in terms of any type of circles through the fullest range of motion will help the joints move through the fullest capacity. But let's take, for example, a unique case, and you may have not heard this word before, whether it's any type of like facet arthropathy, where there's facets are joints, but of the spine. Now, when you look at problems with the joints, let's say there's like degeneration or more friction of that joint, that can send referral signals like numbness, tingling to the arms, legs, and whatnot. So if you start to increase that type of glide at that joint, you would want to look at, okay, where is it at and how to go about it. So then you would either look the nutrition route for what comes in your body, and then physically going through actively moving that joint, ideally in a decompressive state. So where you would either hold on hanging from a bar and then moving that specific area, for example, either lower back, mid back. A little bit more challenging with the neck, but you can kind of see where I'm coming from in terms of how to apply that. If you start exploring a few of these things yourself, ideally with a physician in a perfect world, but that would be one different way. Now, let's say we want to build up some of the small muscles and tissues around the spine. First thing I would start with isometric contractions. Like just even put your hand on your lower back. Try to squeeze exactly where those tissues are. Can you work up? Can you squeeze there? Okay. If not, I'd work into that. Now, let's say if you're able to contract, you're able to control that communication better. Now, squeezing and then either going through tilts, flexion, extension as you're contracting those tissues, which adds in a lengthened state. It also can add in a concentric, eccentric state, which can bleed into the muscles as well. And then you can get into some of these functional movements. But from there, you want to stabilize first, ideally before mobilization to a certain extent. So some people are a little different in that regard, but in terms of getting full mobility, those circles, those workspaces, in addition to the contractions. But you'd want to first start the contractions along the spine and or certain other areas of the body, and then add in workspaces from there. Adding in breath working works incredibly well. And just to go explore, get on the ground, sit on the ground instead of the couch, play with your kids, especially if you feel like there's some tightness, tension, maybe no pain. Your body needs movement. If you're stuck in a position for a long period of time, the body and the small muscles along the spine can only handle so much load before everything tightens up and guards. That's why when we say, what's the perfect posture? If you hold a perfect posture, the body will atrophy over time, and it's only going to give you what you find yourself doing. So if you're standing or sitting in a perfect posture, you're going to limit all this other mobility. Yes, you want to be able to have a proper posture, but the best posture is the ability to move in any position at any time with no limitations.
Oh, I like that. I like the way you put that. And that can be a kind of a misconception that we have a lot with patients, which is, doc, my posture, how can I have better posture? What should my posture look like? And I always like to say, no matter how hard you try to sit for 8 hours, the fact that you sat for 8 hours was actually the issue. It had nothing to do with how you sat, whether that's posture-wise or not. It's the fact that you sat for 8 hours, and now we have to try to out-train your sedentary job, unfortunately, once you are out of that job. Now it's time to go move, to go work out, to go train, and to do it adamantly and consistently, because we just were talking about how one of the recent studies we brought on the pod was moderate exercise doesn't even counteract a sedentary lifestyle anymore, a sedentary job. We're actually seeing that it takes very consistent and specific training to counteract if you have an 8 to 10 hour shift of sitting.
Absolutely.
And thinking that even just moderate exercise isn't even helping anymore, we have a lot more work to do, and we have a lot more education to do to make sure patients have a working body even though they have a job that requires them to sit for long periods of time.
100%. What is one factor we all have to pay attention to, and is gravity, putting pressure on our system. Now, the unique part with this, and we learned this, it's probably been a few months, to where if you're closer to the equator, you have less gravitational force based on like the rotation of the Earth versus closer to the pole. So if you're like higher in Northern America, like Canada versus, or like Antarctica or like South Africa kind of deal, that those areas have more pressure because the Earth is spinning at a faster pace versus if it was in the equator. It's a difference, but it can add into the equation. So like when people start moving to like warmer climates, warmer weather, that's also closer to the equator. So is it the weather of the heat to where it helps soothe the joints, it's easier to move, or is it less pressure against gravity? I don't know if we'll ever know that answer to that question, but it's a different perspective of understanding the pressure against gravity. And then that goes to the point of the posture sitting. If you're sitting, that's going to be the main problem in the first place.
Right.
But if you're, let's say, for example, like you're a construction worker, you're doing consecutive movements over a period of time, that can cause injury unless you counteract that movement, one, or pay attention to where your body is at. Either if you're rotating or doing something consistently on one side of your body, are you able to twist your body and do it on the other side?
Yeah.
That would be another way that you can go about to optimize and not only just use one part of the body, because compensations can take effect and affect everything else above or below, but to try to equal out each side, whether it's forward to backwards movements, side to side, or even rotational work too. So different things to keep in track.
I think there's a lot that can be said on how you can go about training and improving your life, and we've done podcasts about that. So if you truly are interested, I would encourage you to dive into those pods because that's where you're going to get really the nitty gritty of what we're talking about.
More specifics.
But just as a general, I would say in the beginning, if you feel like stretching and doing those workspaces and starting to try to train yourself isn't working, that's where we asked to come in. We start incorporating adjustments, more specific PT that maybe you aren't trying, and then adding in some other things that we have in the clinic. That's where we're going to see probably some better outcomes if you haven't already seen them yourself.
Yes.
But that's really what I want to end on, is just how powerful the adjustment is.
Yeah.
That's where I feel like I want to leave my 2 cents is I wish we had better research to show what the adjustment does to the body. Now we're getting there. We've been able to pick up some certain biometrics, whether that's upregulation of anti-inflammatory cytokines, whether that's neurological stimulation, which we have seen. Now, to what extent, we still don't know, but in the many years that I've been doing this, and I'm sure Dr. Jace can agree, and a lot of the other providers we've spoken to that have been doing this for how many years, they know that getting adjusted regularly has helped not only keep their pain down, their function and performance up, but anecdotally, we have seen immune system changes, less sickness. There have been times where patients have stated that some of their very debilitating symptoms have gone away. Some patients who have had intense itching or like other systemic issues, we've seen changes with adjustments. We don't know why, and we can't tell you why.
Yep.
But there are times where patients who have trouble going to the bathroom, we've seen changes there. I'm sure we could go down a laundry list of just non-pain symptoms that we have seen change with chiropractic adjustments and just regular care that we can't attribute to why it's helping. We have a theory, and I think that theory is good. Just again, nervous system change. We're improving the communication between the body, the signaling, and I think overall that just helps us heal. But Doc, is there any stories or any maybe more input into that you feel patients should know more about?
Yeah, when you brought that up, there's a couple that came to my mind. Yeah. And there's just so many that we can go off of. It's almost like almost every person that comes in the office, they get benefit from it to a certain extent. Depends on what they do with their rehabilitation care kind of deal. But one of the bigger things straight from the adjustments itself, there's an individual that came in, bigger, like buffer dude. He got hit in the back with an object and it forced his body to collapse. He's had stuff going on with his shoulders, so much to where it even caused a tremor in his hand, to where now the tremor is almost completely gone.
Damn.
And then in terms of the lower back, he was going to the bathroom frequently on a consistent basis. And now that has regulated to where it's only maybe a couple times a day or at a normal pace. So just even then itself, it's incredible that it can help with either certain areas of the tremors, it can help with balance, it can help with how certain organs are functioning. Even I had another crazy one, this is probably, over a year now. So to where a lady came in, she's been trying to get pregnant for years on end. And after going through a bout of chiropractic care, she was able to get pregnant. So that was incredible.
And those are stories I've heard as well. And again, we don't want you to think of that as the cure or the next step for you in your journey of fertility.
Yes.
However, these are just things that we witnessed and heard. And so, again, we're not going and saying that is how you should increase fertility, but it's just worth researching and maybe looking into. Yeah, some of the other ones that I can think about on the top of my head, even just simple ones that we think are simple, but to other people probably are like, whoa, crazy. I had a gentleman who could not walk. He had a limp. He had a horrible ankle pain, and he did not know what was going on. And he was a janitor, on his feet a lot. And I went and I looked at his body, and I said he had arthritic changes, degenerative changes in a lot of his body, but the pain was at his ankle. And so I was like, okay, let's look at the ankle. And very stiff ankle. And I'm like, okay, so this is probably what we'll need to do. So I adjusted the ankle. Sure. And I gave a simple long axis distraction. There was a pop.
Sure.
He stood up and he said, the pain is gone. And he goes, I have been dealing with this for half a year. And I didn't know what was going on. And he goes, that is the first time I've been able to walk without pain.
That's cool.
And that is how I think a lot of people expect care to be when seeing us. It's, I have pain here, adjust me, my pain is gone. Hey, if we could do that with everyone, we would do it.
That would make my job
Trust
so
me,
much easier.
we're not withholding the good stuff.
Yes.
We're trying everything we can to get you out of pain as soon as we can. But in those scenarios where we might have had a bone that just more than likely tilted or tipped, those are the kinds of things that we see change with very quickly, and it's fun because we want to get patients out of pain as soon as possible. And there are times where the bones and the joints are more degenerated. It takes longer to move and to get stable and strong. But ultimately, we see changes all the time. It can be very quick. Sometimes it takes time. But I would say, and Doc can probably agree, well over 80, even 85% of patients that we see get results within 2 to 4 weeks.
More time, or they start noticing some sort of improvement thereof. Yes,
for sure.
Yeah.
And so, I love what we do. I completely think that everyone should be at least seeing a chiropractor regularly.
Agreed.
Even if you're a young, healthy individual.
So important.
If you have any aspiration to gain muscle and to train more and to improve and strive for some type of performance, I think a chiropractor should be in your corner. I think if you have gotten to the point in life where you are tired and you are sore and you have been in a lot of pain and you just don't know where to go, I think a chiropractor should be in your corner.
Absolutely.
Yeah.
Yeah, I don't know how people don't go throughout life without getting adjusted. I know for myself, like obviously everyone wants to optimize their bodies and feel the best they can and enjoy life.
Yep.
I don't know if I could do that without getting adjusted.
For sure.
Even if there's like tight restrictions, limitations, it will affect your mental mood over a period of time. Agitation, frustration, fatigue will be another aspect there too.
Yeah.
There's a lot of stuff that even on a mental state, chiropractic can help with. I think this is when you were here, there's a younger lady individual to where she couldn't focus at school, had depressive symptoms.
Yeah.
After going through a bout of chiropractic, her parents even said that everything switched. Like her mental mind improved, her joy came back. She was able to enjoy everything she was doing in life.
That's unreal.
Yeah,
That's
so
awesome.
It's those small things. Like it affects everything.
I think just because we see patients regularly is another help where we can start to create a better, stronger form of communication with you. We want you.
Yes.
We want to empower you. We want to give you the tools to help yourself. We want to uplift you, and I think there's also a part of that with the provider you choose.
Yes.
Making sure that they're using words that are specific and pertinent to helping you, and not saying, not only just chiropractors, unfortunately this is a lot of providers.
Any doctor.
We don't want things that don't give you hope, which is you're gonna have to live with this for the rest of your life, and oh, this is the worst we've seen, and just using these words that can tear you down and make you feel like you're not gonna get better. Trust me, we hear it all the time, so we know it's out there. We're not just saying this, we've heard it time and time, week after week probably.
Uphill battle.
And now that our job is to basically tear down what you thought about yourself and actually rebuild what you could be and give you that kind of hope and joy. And it sounds like obviously she had a lot of that. She was given a different perspective of what she could be, got there, and that's such a cool story.
Yeah,
it's awesome.
Absolutely. I would suggest almost every person at least to get examined or checked out by a chiropractor, obviously to your discretion. But in terms of who to choose, like we said, in a perfect world, you'd want someone to look at not only the spine, the bones, the joints, but also the muscle tissue around it, whether it's a chiropractor or even a physical therapist. Even physical therapists can adjust people as well. They're probably not trained as much as a chiropractor, more times than not.
And most would agree with you.
But at the same time, they're able to help out significantly to a certain extent as well.
Sure.
So
I think anytime you're getting into a place that has multiple modals of care, PT, chiro, maybe they have a medical provider on staff, do other types of therapy, treatments, injections, those things, you're going to see probably a lot more outcomes, in our opinion. Other than that, just making sure that you go on their website and they have other opportunities, other treatments other than just chiropractic is maybe a good next step too. But
more tools in the tool belt.
Yeah, I think if you do have any questions about that, please drop comments, email us, let us just reach out to us. We both have a lot of connections and networks to even other states. And I think we could do a good job of just going online and probably even finding one for you if you wanted some help. I would have no problem helping out with that.
Yeah, one of the bigger things I look at, Google mapping, go to the website, look at the reviews, just to see, and then there's a bunch of other specifics with that, but that would be, yes, where I'd start.
Perfect, perfect. Is there anything else, Doc, you want to leave the viewers?
Get adjusted. You don't have to go your entire life. I don't know why you wouldn't, but that's neither here nor there. And then to address the muscles and tissues surrounding the spine. And then if you feel like anyone in your family or yourself are having these weird other symptoms that maybe other docs are either confused by, or you've went to other people and nothing's cleared up, this would be a route that I would highly suggest to try, because there's a lot of stuff that we can clear up that you may never have realized.
No. And I don't like to toot my own horn, but I'm going to do this here because I think it'll also tie into what you just said. But we are very well trained. We went through a medical curriculum. We did just as much as anatomy and physiology and chemistry and biology as MDs did. Okay, we're exactly like them as far as a diagnostic standpoint, but we're very heavily tailored to musculoskeletal pain.
Correct.
If you came to us with internal organ issues or maybe things like that, trust me, we got the training in school, but a lot of us didn't stay with that training, and so we're going to refer you for that.
Yeah, if you don't use it, you lose it.
Exactly. So, but did we train on diverticulitis and IBS and all the skin conditions that you can think of, microbiology, pathophysiology, blood work, you name it? We did all of that to diagnose those things. But eventually, most of us lean in and geared towards musculoskeletal nerve issues, and that's where obviously we shine. But we have immense amount of training. We see a lot of conditions. We know what to do to help the ones we can help with, and we know where you need to get if a referral is necessary. So we are an incredibly safe profession. We're one of the safest, if not the safest. We have one of the lowest malpractice insurances for the providers. I think we're the lowest just because of how safe we are. There's a lot of misconceptions about what chiropractors can do as far as harm. Yes, unfortunately.
Let's speak on stroke.
I think with any profession, with any provider, if you give treatment, there's always risks to that. I want you to understand that. But in this profession that we have, in the 5+ years that I've been practicing, I've never had any, what would you call it, malpractice claims against me. We've never injured anybody. We have never caused anyone to have serious harm, other than some soreness, obviously, from treatment, which is to be expected. That's really the most common thing that we see. Now, there are times where providers don't do a good job of examining and screening patients, and that's in any profession. This happens in neurology, this happens in internal med, this happens in anywhere you go. In our profession, we now have this tag on our shoulder, or this bullseye, that we can cause strokes, okay? And I'm just going to put that as my ending piece to say that is completely not true. Do we see patients that have a risk of stroke? Absolutely.
Yes.
Do we see patients that may be close to having a stroke or having issues with artery or blood flow? Yes. Is it our job just as much as the medical doctor's job to assess and make sure that there is no contraindication to adjusting? Correct. Absolutely.
Yes.
Now, what has been shown over time in research was if a patient who was about to have a stroke went to see a medical doctor or a chiropractor, in those studies, they looked back and they showed that there was no difference in the occurrence of stroke if they would have seen a chiropractor or a medical doctor. Basically meaning that they were going to have the stroke regardless, and whether or not they saw one or the other had nothing to do with the stroke in itself. We have seen countless research has come out from Medicare has done their own research. Insurance companies are doing their own research. We've seen blood flow studies showing no hemodynamic changes to the arteries when we do adjustments. We're seeing more and more research showing that basically it is an unfortunate strike of luck, lightning strike, that a stroke does happen to happen under our care, but they have shown no causation and they have shown no attribution to the chiropractor other than they missed it.
Yes.
And they should have referred out for an ultrasound, or the patient should have been seen elsewhere.
Yes.
And they were bound to get that stroke no matter what.
Yes.
And that is where I will put the blame on the chiropractor, just like any other provider who would have missed it had they not done a proper exam.
Correct. I'm really glad you stated that.
Yeah.
Because that's such a common thing that, I wouldn't say common, we're hearing it less and less because I think that people are understanding some of this a little bit better, but it's something that any provider, whether it's stroke or any other type of injury, that you have to be detailed in the assessment.
Yep.
And then from there, obviously knowing what's going on is different than the actual treatments itself. So there's two different things, but knowing is hugely important to understand how to go about fixing anything
for sure.
there. So.
Doc, is there anything else you want to leave the audience?
Oh, that was beautiful. I think they got some of the nuts, bolts, the main purpose of this episode. If you guys want to go back, there's a 2-hour plus video. If you go back in our past podcasts to this exact image, that would be the one. We dive into a couple other fun stories, a couple other interesting things, more research. Awesome listen to on that one, but outside that, share, subscribe, share to anyone that you feel that could benefit, which should be pretty much everyone, quite frankly. But
For sure. We see all ages. Anyone could use a chiro, for sure.
Oh, yeah. So those I think my earliest adjustment was like 2 weeks old, and I think my oldest was like 95.
Yep.
So
for sure.
Huge range.
Yeah, we can see them all, help anybody who's got a body, and we're happy to do it. Until next time, guys, thank you so much for watching and listening. Please share, and we'll see you guys soon.
Woo!
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.